Keith Tebow from FRCMedia. Thank you for joining us today. We've talked a lot during the pandemic about people being healthy, and we've talked about how, the pandemic has impacted our two hospitals, St. Anne's and Charlton Memorial. But I want to get a little bit more to talk about health on a community basis, and I want to spend a little time today talking about the HealthFirst Family Care Center on Quarry Street in Fall River. And they've announced recently that they have a brand new chief medical officer. And I'm pleased to be joined today by the chief medical officer at HealthFirst, Dr. Eric Vaught. Dr. Vaught, how are you? Thank you for joining me today. How are you?
I'm doing well. It's a pleasure to be on.
I want to talk a little bit about community health in general and some of the things that are happening at HealthFirst. But first, I guess, introduce yourself to the Fall River community. Where are you from and how you got to be at HealthFirst?
Yeah, thank you. Happy to be here. So I'm a Navy physician who recently went from active duty into the reserves and spent 12 years on active duty, and then was able to get this job here in Fall River and have been in the position since July of this year. And so just all of the things that come along with a big transition for myself and my family. In the midst of a global pandemic, but we've enjoyed getting to know the folks here at the organization and then throughout the community, and just looking forward to setting up roots and being a part of the Fall River community moving forward.
Community healthcare, people will hear that term, and a lot of people may say, well, the community healthcare is, through hospitals, but HealthFirst has been really ingrained in our community for quite a while now. Well known within the community, of course. Its executive director Julie Almond is well known throughout Fall River. I guess what were your instincts about community healthcare, and when you came to Fall River, what have you learned about the process and the people here and how HealthFirst works?
Yeah, great question. So the primary care is the backbone of this country, and getting good primary care and having that doctor that you can call your primary care physician is so important. I will always be an advocate that patients should get in and see their physician on a regular basis. And here at HealthFirst, we're that outreach to the community. We're the opportunity for folks to have that continuity of care and not necessarily have to go to the emergency room or an urgent care facility for those non-urgent or emergent things. And so the biggest thing that I can say is that we are that outreach for preventative care. And in the midst of COVID, remembering to do being able to do all of the preventative care measures is a big challenge. And so we have tried our best in the midst of COVID to remain open and to remain accessible to our patients. And then your question about what's the role of the community health center in the community. It's just that we are community driven. So we're both internally taking care of the patients that come into our facility, taking care of their medical needs, their mental health needs, their dental needs. But then we're also outward facing. We're in the community doing outreach in the schools, doing outreach in our community areas, and across all languages and demographics that make up Fall River.
Yeah, I guess that is important to note in general about community health centers. It's not just about if you're ill, someplace to go. You mentioned that it's a wide swath of services. You get the dental services that you won't find generally in a hospital setting, and also those other educational purposes. I know we've done some news stories with HealthFirst around, the farmers market and eating healthy. So it's that educational component as well that's important that you would find maybe in some other locations, but a community health center really is a place where you find a lot of that information, correct?
Absolutely. You're spot on. And the idea that your health is so much more than coming in and seeing your provider and me giving you a prescription. It encompasses your housing, your ability to eat nutritious meals, to get the dental care that you need. All those things make up the health of a person, and so as an organization, that is our goal is to look at the whole individual and provide as many services to assist them as possible.
You mentioned earlier about, and I do want to ask some COVID related questions in a moment, but you talked about how it's still important for people to do their preventative medicine and their preventative visits to see doctors. Has there been sort of a downturn in that because of the pandemic, or have people still tried to follow through? And I guess what are the negative impacts of not following through in the long term?
So the far-reaching effects of 2020 and just the effects of the pandemic on health, I think are going to be felt for decades to come. We have seen people have barriers to being able to get a mammogram for breast cancer screening, or a colonoscopy for colorectal screening, and those things are going to have a downstream effect on people's health. And so, as a community health center, we've taken a very forward approach to outreach to those patients, to work with our specialists and our folks at South Coast and St. Anne's to get those folks in and get the screening that they need. But you're right, it is something that we're going to have to monitor over the next decade.
Yeah. All right, I want to ask you just a couple of COVID-related questions as it impacts HealthFirst. There was a time there was a drive-in COVID testing site. I guess that has ended for the time being. What was that traffic like there at the center? And I guess with the current uptick in number of cases in Fall River and elsewhere, how has HealthFirst been able to handle that increase in traffic, if you will, for people who may feel they have the disease?
Yeah. So on October 31st, the state of Massachusetts made a few strategic decisions when it came to community-based testing. Across the state, they picked locations in each of the communities where they wanted to continue the Stop the Spread initiative. HealthFirst, unfortunately, was not one of those sites selected to continue community-based testing. However, our patients and those in the community that would like to be tested, or that are part of our patient population, are still welcome to come to the health center and get tested. And the best way they can do that is calling our health center at 508-679-8111, and we'll get them set up with a time to either see a provider and then get tested, or to just get tested here at our facility. And so we continue to do a couple hundred tests each week, but our community-based testing did end a couple weeks ago.
And how has traffic been in terms of people with symptoms coming in to get tested? Are you seeing the uptick as our hospitals are as well?
Absolutely. So unfortunately, we're still seeing a positivity rate of the folks that we're testing, 15 to 16%, which is in alignment with what we're seeing across the city of Fall River. And so, again, I encourage people to continue to wear their masks, continue to social distance, and probably as we go into the holiday season, the most important thing is thinking about those community gatherings. The Governor Baker has come out and emphasized to limit the number of people in inside gatherings, and I just would encourage folks to really adhere to that. We unfortunately we see testing results where entire families test positive after being in close contact at a gathering, and so it's on each one of us to think about that over the next week as the holidays approach.
All right, Dr. Eric Vaught, I appreciate the new Chief Medical Officer at HealthFirst Family Care Center. Congratulations, even though you've been there for quite some time and have gotten a little bit used to Fall River. Thank you for joining us, and hopefully we'll talk again in the future about some other health initiatives at HealthFirst. Thank you for joining me. I appreciate it.
Absolutely. Thank you so much.
All right. And thank you for joining us today here in FRC Media.